Dr. Dlomo, thank you so much for coming through and talking to me. So, obviously, this is an issue of concern for you, and the numbers speak for themselves in as far as the maternal deaths, are concerned, and the percentage thereof that is accounted for by teenage pregnancies.
Good evening to us, and good evening to our viewers. Thank you very much for these opportunities. Yes, indeed. When you look into what was presented to us in another meeting by the committee that deals with the maternal deaths in the country, and it made an estimation that of the million deliveries of women in the country, which probably people have not been aware, we deliver about a million women in the country per year. About 10% of that is teenage pregnancies. Now, there's about 100,000 of that. I can actually concur with that figure because as a KwaZulu-Natal, we pick figures up to 28,000 per year of teenage pregnancies. So countrywide, yes, 100,000 is probably a correct figure. Now, when you go to the maternal deaths, you then find that the percentage of this 8 to 10% of teenage pregnancies account for almost half of the maternal deaths that we find in the province, in the country. Now, that tells you, if you were to reduce or to remove the teenage pregnancy, you'll almost halve your maternal deaths in the country.
And how do you understand that phenomenon, Dr. Dlomo? Why is it that, teenagers who account for about 10% of all the deliveries and births per year actually account for over half of the maternal deaths? Is it something to do with the physiology of a young person and having to carry, a pregnancy over a period of some months, 9 months? Or is it other factors that are more socio-economic?
Multiple factors to assess. One of that is that these are teenagers whose bodies are not physiologically strong and able to carry a pregnancy. But over and above that, they do not come to our antenatal clinics much earlier, and therefore they delay seeking help as pregnant mothers. And by the time they come, some of the complications have set in that you probably cannot reverse. Hence, we're influenced by that in the province, by therefore opening up our clinics. And now, currently, we have trained over 430 nurses in programs that we call youth user-friendly services, where up at around 3 o'clock in the afternoon, our clinics are readily available to be accessed by teenagers in the high schools, and we find a nurse there who's ready to educate them, have dialogues, and we have seen an impact in some pockets of our clinics where this matter has happened, where we actually get them to be engaged in discussions. How do you delay getting pregnant even if you already have a boyfriend or that? So that is assisting here and there, and we think we should accelerate those programs, assisting and empowering teenagers.
And that's something that not many people would have thought about, that it's perhaps difficult for a teenager to actually start accessing the antenatal services where in a situation where, perhaps even the guardians and the parents are not aware that this person could actually be pregnant.
They have educated us, these teenagers. They said, I'm pregnant here because last time I came here, I was 15 years old and you turned me away when I was asking for family planning programs. That has educated us to say, look, let us make our services youth user-friendly so that when they come in, we don't say, go and ask your priest, go and call your mother and tell her that you are now asking for family planning programs. We are saying these teenagers are responsible enough. They now know that if I've got a boyfriend, I must prevent getting pregnant, so I must go to the clinic. For us, is not to judge, is to assist them to delay the pregnancies. So where this has actually happened and nurses have really shifted their thinking in terms of support, we have seen success stories. We are busy documenting that in the province, where we have seen some success stories here and there, and we think that will going to help to say, take these teenagers into confidence, accept that these are human beings who are now saying, I don't want to fall pregnant now. What can you do to assist me?
The flip side of this story, though, Dr. Dlomo, the fact that so many teenagers are getting pregnant to the point of accounting for about 10% of all births in the country and 50% of maternal deaths, suggests that the message about safe sex and abstention, those messages that you invest so many resources into, perhaps it's not penetrating the way that it should, and it's not being received and acted upon.
Maybe, we should not lose a focus on this. That is why I'm saying, since that matter was given to us by the committee that looks into the maternal deaths, we have started these programs in the province, and we are seeing pockets of good stories to tell. Therefore, it means you must actually focus on this program, accelerate any program that says, I'm a teenager, I need to be assisted. So we don't want to say it's a failure, but we are saying it has brought to our attention because, as you know, there are three main causes of maternal deaths largely. Is hypertension, is hemorrhage, and HIV and AIDS. Now, we are actually impacting on some of these by reducing. So we have actually seen some strides in terms of these three H's. Now, where we are picking up, focusing on teenagers, I can tell you we will do well if you can just say, yes, all teenagers in our province, in our country, are delaying their pregnancies, or if they've fallen pregnant, they are not hiding the pregnancy. They come early like any other normal mother who has been pregnant, and therefore we assist them early enough in the pregnancy, and therefore the results will be different.
So the dialogue that you are calling for, Dr. Dlomo, what form do you believe it should take? What kind of a campaign are you calling for at a national level?
No, I think some of the lessons that we learn in KwaZulu-Natal, we do share them with the national minister, where we are saying, we actually say, sisters in the clinics, please let us not judge, let us go to the villages. But maybe largely in the province, we are assisted by program Operation Sugumasake, where we actually are targeting and identifying areas where there is a hotspots in terms of large teenage pregnancy. We would want to engage strongly with the education, and we do through Operation Sugumasake. They also give us statistics. So we are focusing on those areas, have dialogues, and ask these young girls why and what is making you to actually do this. And therefore, issues of sugar daddies, we said, look, put that aside. The She Conquers campaigns are saying, I am a teenager. I want to finish my matric without HIV. I want to finish my matric without without pregnancy. What do I do? How can I be assisted? So we are, like I'm saying, we have not really been able to provide you, Thulasizwe, with the results. But here in the province, it's a very big province. We could actually give you of some success stories, sure, pockets of excellences, where this continued focus and dialogue with the teenagers in schools, out of schools, is yielding positive results.
Dr. Sibongiseni Dlomo, thank you so much for coming through. Good to see you in 2019, and a happy new year to you. Dr. Sibongiseni Dlomo is the MEC of Health in KwaZulu-Natal.